great. Well, sure, we'll make a start because just conscious of the time and everybody's lunch hour. So you're all very welcome today to this member forum, which we're going to focus specifically on the COVID-19 vaccination programme and all things COVID. So delighted today to be joined by my colleagues Jasmine Shah from our pharmacy services team and Glyn Waldock from our indemnity team, professional indemnity team. Also pleased to have Adam Thornhill with us, who is from MedicSpot, and we're going to kick off just with Adam having a look at an opportunity with PCR testing within the pharmacy, and then we'll move on to the COVID vaccine service. Lots of time for questions and answers. If you want to, anything that crops up as we progress, if you want to put it in the chat box, or raise a hand, but possibly put it in the chat box because I'm working off my laptop, so I've limited view of who's just to keep monitoring that. So put it in the chat box and we can pick up and draw it into the conversation then. I'll hand over to Adam and just going to take us through the product available and how it operates. So over to you, Adam.
Amazing, thank you very much, Anne. And super interesting to see people's insights as well there about kind of how many kind of times you're getting asked about COVID testing and fit to travel. We've found that for a lot of the pharmacies across the UK that we're working with is there, particularly before lockdown, there's significant demand. Even now there is demand despite barely any flights going out. We anticipate kind of post-lockdown a massive surge in people wanting to travel. Even if you just think about yourself, I personally am itching to get on a plane and escape the cold weather of Britain. So we're really excited to partner with the NPA to provide a deep discount for our COVID testing service. So NPA members are able to purchase MedicSpot tests and then resell those on at a profit. So it's an incredible opportunity for pharmacies to kind of add an additional revenue stream at a time when kind of travel jabs and other services might be kind of a lot slower than normal. And so, yeah, if you want to go to the next slide, Anne, I'll give you a little bit more details about what we're doing and what the opportunity is for members. So no worries, there you go. So I'm sure, obviously, you're all aware the NHS is doing an incredible job providing COVID testing to the public, particularly those who are symptomatic. But for international travel, if you've travelled since the pandemic, if you're going outside of the UK, you require a negative COVID-19 PCR test result within a very short time span. Usually it's within about 72 hours of your flight window, sometimes 96, sometimes even 48 hours. So the NHS tests aren't actually allowed to be used for travel purposes. So there's a very big opportunity for pharmacies to get involved with COVID testing for the kind of private testing market for travel purposes. So next slide, please, Anne.
Sorry.
No worries at all. So I'm sure a lot of you, particularly those who kind of get asked frequently from customers, have probably also been approached by other providers about purchasing tests from them and then reselling them on. There are obviously a lot of different testing types, whether it be antibody, antigen, and PCR. But PCR is the current gold standard in order to travel. So most countries, most airlines require a negative COVID-19 PCR test. And what we're able to do is actually provide an all-in-one solution. So that rather than you kind of having to field 100 customer calls a day, deal with the logistics, the relationship with the labs, the results to customers chasing for said results, we're offering kind of an all-in-one hassle-free solution for members. So you purchase the tests at a really deep bulk price, and then you kind of sell it on, and that's it. It's a kind of a sell and forget model. So you can really focus your time on running your business and all the other services that you provide. Next slide, please, Anne. So, thank you. A lot of other pharmacies, we're working with kind of pharmacies across the UK providing this right now. And we're looking at kind of working with more by selling tests to you guys and you can sell that on. So a really good example is Shazad from Newington Pharmacy in Edinburgh. He was having kind of customers drive up to 100 miles away just to come and buy testing, so that they can fly out, being kind of contextualizing that was obviously pre-lockdown, but they were seeing over 100 calls a day from customers, and it was very difficult for them to manage that as well as the rest of their business. So they kind of just worked directly with us, kind of been purchasing tests from us, and we have then taken care of all the customer service, the logistics, the lab relationships, the certification, and kind of made their life 10 times easier. So he's really, really happy about the outcome of working with us, and it just goes to show that there are different options in the market. You can buy them relatively cheap, but you kind of have to take all that hassle on. You have to self-declare all yourself for the most part, but we kind of provide this all-in-one solution. And there have been new guidance from the government in England about self-declaration for COVID testing. We're double checking what those guidelines are going to be for Northern Ireland, but what we're making sure is that we put together this pack, so if you do have to self-declare, it's super easy and streamlined for a pharmacy to go through those steps to then sell COVID testing. So next slide, please, Anne. So we're really proud to offer such a deep discount for you guys. If you obviously, depending, it's a sliding scale depending on how many you buy, the deeper the discount that you get. Our tests retail for £149, so we actually sell our test to our own customers as well. So as you can just see here, it's a really good opportunity for you to purchase low in bulk and then kind of sell this onwards at whatever price you want. Like I say, we do retail ours at £149. But I'll get into next slide, please, Anne, and I'll show you a little bit of an anecdote just about how much of an opportunity there is. So assuming that you want to make at least £1,000 profit per month, all you actually need to do is sell 10 tests a week. So for a little bit of context, some of our best performing pharmacies were selling upwards of 100 tests a day pre-lockdown. So you can imagine kind of the size of the return there for them from a profit perspective. So in all honesty, it's such a big opportunity. Even people who are seeing seldom people asking about whether COVID testing is available within your pharmacy. Obviously, that's when there are basically 0 flights going out at the moment. So you can imagine extrapolating that out 10x, 15x post-lockdown, that we're really expecting significant demand, and think there's an amazing opportunity for members to add a really strong revenue line and generate a lot of profit for themselves post-lockdown. So next slide, please, Anne. So we're finalising the nuts and bolts, dotting our I's, crossing our T's with the NPA, and just double checking everything around the self-declaration side of things. So we're expecting to launch hopefully next week, and we'll have a self-serve portal where you can purchase tests from us. Alternatively, if you have any questions, you can go to anyone at the NPA, or alternatively contact our sales team as well. So kind of watch this space. We're really excited about launching with the NPA very soon, and are really excited for you guys to have this opportunity to increase revenue streams. So I have about 5 minutes to answer a few questions if you guys have any. I've seen a couple come in and chat, and then I'm going to have to dash, but there'll be more information coming out next week as well.
Yeah, we had a question there from Shailen. Adam, is the test completed in pharmacy, or is it a take home?
So we recommend that the test isn't completed in the pharmacy. So they would take it home, and there's 2 methods of returning it to our labs. They can either use one of our pick-up and drop-off locations. We currently have over 65 across the UK, or it also includes a prepaid Royal Mail return label. So there's 35,000 priority post boxes across the UK where they can just return their kit, their completed sample that way as well.
And funny, Adam presented this to the NPA team last week. So I went on, I'd never heard of priority post boxes before, but the one at the bottom of our street is a priority post box. So there you go.
Good to know. Yeah, I didn't realize how many there were until we kind of got into it. So it's really accessible for customers to purchase tests from you guys and then just return it at their convenience.
Yeah. And the other question we had there, sorry, from Ronnie, I've just lost it. Sorry, can you see it, Adam, there?
Can we sell your tests online, is the question?
Yeah. Yes. So first of all, I've just seen Joanne's. That's a very easy one to do. Its tests aren't vatable. In terms of selling the tests online, you can promote the tests through social, on your website, and then customers just can come in store and purchase those tests off you. So however you usually can promote any of your services, feel free to leverage any of those marketing channels. Anyone who buys tests from us, we provide a free digital marketing pack. So that includes kind of social media assets, digital assets in case you have kind of those HealthPoint TV screens in your pharmacy. So we're trying to make it as easy as possible for you to sell. We also have a travel planner. So if you go to medicspot.co.uk/planner, it basically allows you to ask customers 2 questions. One, what's the time window for your flight? So 72 or 96 hours. And then what is the date that they're flying? And then it will give a breakdown as to when they should buy the test, when they should take the test, when they should return the test, when they can expect their results. So just asking those 2 questions on our website, and it will kind of pop out all the answers that you can then convey to customers to make it a really seamless sale.
And there's a few questions, Adam, just on the turnaround time. So from whether you drop it off at a hub or the priority posting.
Yeah. So if you drop it off a hub by 2 p.m, results will be next day by 11:59 p.m. So well within that 48-hour time window. And so that's something we're really kind of passionate about meeting, and are fortunate enough that we can provide those really quick times. Alternatively, with the Royal Mail priority post boxes, they're tracked 24, so it should take 24 hours to get to the lab, and then 24 hours for the lab to then send the results to us and us to send it to the customer. So you're usually talking about a 48-hour turnaround. Most flights are 72 or 96-hour windows. So using the travel planner that we have on our website, if you just entered in any kind of time window and dates, then it will populate when it is suitable for taking the test.
Yep. And I think the last question there is just about the suitability. Are all countries accepting them?
Yes. So
how do you find out which countries require which testing?
Yeah. So every single customer we've served with our doctor signed fit to fly certificates and negative PCR results, they've all been accepted by the country. We haven't ever had an issue with a certificate not being accepted. Most countries require the PCR negative test result. Some require an additional fit to fly certificate. Some require a passport number. There are variations depending on where you're going. We've made ours the gold standard, whereby it meets the requirements of the most difficult and harder restrictions. So that basically then applies to every single country thereafter.
And yet you asked the question about the VAT.
Yeah, I believe our tests aren't vatable.
Yeah, that's okay. Well, look, it's quite an exciting opportunity, and it's something to look forward to. The opportunity to travel again, and if PCR tests are part of that, you know, we're here to help support that. Adam, thank you very much for your time today. If there's any follow-up, we'll certainly keep the communication lines between our members here and with yourself if any more questions come through. I guess that dovetails quite nicely into the main part of what today. So we want to look at vaccines, and hopefully with populations being vaccinated, that lockdowns will lift and we will get to travel again. So we're delighted that the board have announced or asked for expressions of interest to provide COVID vaccination services within pharmacy. And so thought it was timely maybe to help people start thinking what preparations need to be made for these clinics, and using experience of some of our members in England that have been delivering on clinics over the past month or so. So going to hand over to Jasmine, who is going to take us through with lots of points on the agenda there, and some will move over quite quickly, but just how the service runs and some of the key considerations and preparations that you can make at this stage. So Jasmine, I'll hand over to you.
Thank you, Anne. That's really helpful. And as Anne mentioned in the previous slide, there's a number of different aspects of the COVID-19 vaccination program to look at, and we'll aim to cover most of it, or in fact all of it, in today's presentation, although probably not necessarily in that order, but we will aim to cover it all. So just as a means of scene setting, you will all be aware that there are currently 3 temporarily approved or temporarily authorized COVID-19 vaccines in the UK, the Pfizer-BioNTech, the Estrozenica one, and the Moderna. Currently, only the first 2, the Pfizer and the Estrozenica vaccines, are being deployed through the COVID-19 vaccination program in the UK at the moment. We don't have a timeline yet as to when the Moderna vaccine might start to be deployed through the program, so that would be a watch this space. Now, we've had a lot of questions coming through from members who also in turn been asked a lot of questions by the patients in terms of the different characteristics of these vaccines. So we've pulled together the available information on all 3 of these vaccines at the moment into a vaccines characteristics comparison chart, to help you as a quick reference guide to sort of just pick up the key points on each of the vaccines and the specifics of their storage and handling and what they're licensed or authorized for, etc. But secondly, as a means of sharing with your teams to help their information and ultimately to be able to address patient questions as well on that front. So that's available through the NPA website there. Thanks, Anne. Could we have the next one? Thank you. So very briefly, I wanted to just mention the key points from the Pfizer vaccines handling and storage requirements, because unlike most other vaccines that you will have handled in the past, COVID-19 vaccines are quite unique, and especially the Pfizer one is a vaccine that requires deep freeze storage at -70 degrees. And once it's thawed out, it has to be used up within 5 days, but the clock starts ticking on the 5 days the minute it's taken out of the deep freezing storage capacity. So that includes the thawing out time as well for the vaccine, which can be a few hours. So in reality, because the vaccines come in 975 dose packs, once it started being thawed out, all of those doses, all 975 doses, must be administered to patients within a maximum of 3.5 to 4 days at the most. So you can imagine where you need a large number of patients available to ensure you can use them up within the vaccine's viability and the life of the vaccine. The other key thing to mention is that the Pfizer vaccine is also very sensitive to handling. So what I mean here is that the mRNA molecule which is inserted into this is contained within a lipoprotein and is very, very fragile. So if the vaccine is, the packs are shaken or handled roughly, it actually disintegrates the vaccine and it damages the efficacy of the vaccine. So they have to be handled very, very gently, and the less movement they undergo, the better actually. So it's a very sensitive vaccine in that sense as well. The AstraZeneca vaccine, thank you, Anne, doesn't require deep freezing, but it requires fridge storage, which is more sort of what routine vaccines are usually stored at. But again, it does have a limited shelf life, or viability life. Once the vial is pierced, it has to be used up within 6 hours, the number of doses in that vial. They all have to be administered within 6 hours. Both of the vaccines, Pfizer and the AstraZeneca, they're administered to the intramuscular route into the deltoid. Now, most people who've done the flu jabs will be quite familiar with that technique. So that's a standard technique there. And the vaccines in the English program, when they're supplied to the vaccination sites, are supplied along with the injection materials that you need. There's the syringes, needles, all of that come with the vaccine vials. Thanks, Anne.
Yeah, and it's just worth adding, I suppose, Jasmine, sorry, we're waiting confirmation on that from the service back for the service in pharmacies as what will be supplied with them. So we'd imagine it will follow the English model.
Thank you.
Just very briefly on the eligibility program is UK wide. and follows the Joint Committee on Vaccination and Immunisation guidelines. So you'll have seen lots of media coverage that Northern Ireland is moving well with the programme and are now vaccinating the 65 to 69-year-olds. So on target to vaccinate the population by early summer. Again, be familiar with the priority groups and how we've moved down through those from late December. Surrounding that and with the announcement yesterday that there's some documents that are worth having a look at. So the Department of Health document on how the vaccination programme will be deployed in Northern Ireland. And that's supplemented then by the UK-wide information from the Green Book, which is like the Bible of vaccines. And there's a new chapter added for COVID vaccines there. There's guidance for healthcare practitioners and the training resources, which have been referenced within the expression of interest form for the board. So they're using the common training that's been provided by Public Health England, and that's applicable throughout Northern Ireland for the service as well. So just to highlight those. Jasmine, do you want to pick up on the supply chain piece there?
Yes, thank you, Anne. So just a key point in the supply chain for the COVID-19 vaccines, and drawing here on our experience with what queries we've had so far. The COVID-19 vaccination is only available through the NHS Department of Health program route. And that is to say that there is no private element to the administration of COVID-19 vaccine. So there's no private PGD available, and it cannot under any circumstances be offered as a private service to anyone. And that is really important because many of our members have reported being asked by patients to say, actually, we're not in the priority groups or at the moment or the further down the line, and are you able to vaccinate me privately? And the answer is no, actually, there is no private element. Everyone will be called up in the order of priority according to the groups. And as Anne said, the aim is to vaccinate all adults over 18, as soon as possible. In terms of the supply chain, the way it's been set up in England is that the vaccines vials themselves, as well as the equipment and the consumables that go with it to enable you to, draw up the vaccine and inject it, as well as the PPE, all of these consumables, equipment, and vaccines are supplied together in packs, and they're centrally delivered and coordinated by Department of Health Operations and Logistics teams, and they are supplied free of charge to the vaccination centers. So those specific supply chain routes have been set up. So the vaccine equipment, consumables, none of that needs to be ordered through the pharmacy wholesaler route, for example, at the moment. It's all supplied centrally by the DH logistics team. There have been a number of standard operating procedures which have been developed for national use by NHS England, and they cover aspects of how to handle the vaccines, how to store them properly, record keeping, and all of these, and they're available through the Specialist Pharmacy Services website for PCNs as well as for NHS Trust, and they can be used in the community setting as well. So currently, the vaccine ordering system is through a push model, where vaccination centers are proactively delegated an X number of vaccines for their weekly supply, for example. It's not a pull model where the centers can order as many. It's more likely that they have to take what they're delegated at the moment. But it's an evolving situation, and it may change in the future. And we were speaking earlier how it still needs to be worked out how it will operate in Northern Ireland when the service starts, isn't it?
But it's just interesting that within the English service that it's push rather than by request. So we'll watch what the service spec says on that then for us.
So one of the key elements which sort of factors into that push model is actually the vaccine supply. Because you can imagine that the UK government will be receiving the vaccine supplies in stages, and then they take what they have on any given week and allocate it out to the areas of most need. So it's done as a push model accordingly. With the pharmacy-led vaccination sites, which have been implemented so far in England, they work on the basis of a local enhanced service agreement between the NHS England regional teams and the pharmacy contractors. But there are certain key criteria that must be met by all designated sites. And this is not just for pharmacy sites. They are for all vaccination sites, and these provide the assurance and the governance and meeting of the professional standards to ensure that everything works in a clinical professional manner. So the key criteria cover things like vaccine storage, because you can imagine if the sites are being delivered nearly 1,000 doses of vaccines every week, and the equipment and consumables that go with it, they need to have sufficient storage capacity, the right type of storage capacity, and the planning and coordination of how to manage appointments, bookings, patient flow, continue to manage usual pharmaceutical services if they're on site as well, how much vaccinator workforce they have. So there's a number of criteria to be looked at. And currently at the moment in England, the one non-negotiable requirement is that each designated vaccination site has to be able to administer and have the capacity to administer at least 1,000 vaccine doses per week. But in reality, it needs to be a shorter space of time, because as we said earlier, the Pfizer vaccine needs to be administered within 3.5 to 4 weeks. 3.5 to 4 days, apologies. What we have heard, however, is that most of the pharmacy sites in England, they've only been given the Estrozenica vaccine to administer, not the Pfizer vaccine. So with the Estrozenica vaccine, it's still a requirement to do 1,000 jabs a week, essentially. And it might be a different story in Northern Ireland.
Yeah, I mean, again, waiting on the service back, Jasmine, and in the pharmacy-based site, the community pharmacy site or service, there isn't mention of a minimum requirement. We've also had a call for expressions of interest to provide mass vaccination sites by pharmacists, and that mirrors that requirement that the site must be able to administer at least 1,000 vaccines a week. So we'll see what the in-pharmacy service will look like in terms of requirements.
Brilliant. So moving on, as I mentioned earlier, so in the English service, what is happening is the vaccines, consumables, PPE is all being centrally supplied. The vaccine ordering process is a push model at the moment, but that may change and evolve. So what we talk about the supplies is the linked consumables, because the vials come, the vaccine come in vials. So the Pfizer vaccine is a freeze-dried powder which needs to be had a diluent added to it before it's sort of ready to be used. And the AstraZeneca one also needs to be drawn up to the right dose. So you need the vaccine, the syringes and needles that come with it. And this is where the training and competency requirements are a little bit different, and we'll talk about them later. Because where you have to draw up vaccines, normally you change a needle before administering it. That's not the same for these vaccines. So there's a lot of training elements to do with vaccine preparation and administration of it as well. So, but again, this will be worked through as part of the process that's being set up in Northern Ireland, how all of these things will work. Thank you, Anne.
My mouse is frozen, sorry.
Yeah.
So yeah, just looking again from our expression of interest form, we know that it's a standard fee throughout the UK per vaccination of £12.58, and that's across the 2 doses, to give a remuneration of £25.16 for participation in the service. It was also noted in the expression of interest form that there will be some funding for setup fees, so that is yet to be confirmed. And as is the process then of making appointments, we're not sure yet of who the cohort group who will be allocated to pharmacy, or how pharmacy will tap into those people to make appointments with them, or whether it'll be a centrally operated appointment system where someone can go on and select the site and make the booking from a central place, as is at the moment. And the process then to record vaccination data that will be captured electronically in a system similar to that's been used for the flu vaccine and the frontline healthcare workers this year. So that's worked well and fairly streamlined. So it will be a system that will mirror that.
Vaccine is actually a concentrate for solution for injection, which has to be diluted first before using. It's not a powder, it comes as a concentrated solution, which is and the diluent comes with the vaccine. So apologies for that. Yes, so in terms of the legal authorities, so the human medicines regulations have been amended and updated in 2020 to provide the legal authority for administering the COVID-19 vaccines, as well as, and it covers flu vaccines as well, which may have an impact later on down the line. So there's two legal mechanisms. PGDs as a patient group direction to administer the COVID vaccine. You will all be familiar with it, hopefully having used PGDs to administer the flu vaccine over the last few years. So, and with the PGDs, the pharmacist is the vaccinator for the PGD, where they do the end-to-end process is managed by the pharmacists themselves, and no element of it can be delegated to a different individual. Now, a new type of legal mechanism has been introduced in October 2020 with the amended human medicines regulations, and that's the national protocol. A national protocol is built almost like a PGD. However, it doesn't work quite the same as a PGD because it's split up into 4 stages. And under a national protocol, the different stages of the process can actually be delegated out to different individuals, and how the delegation can work is laid out within the protocol itself. So pharmacies now have an option, if they're going to provide a COVID-19 vaccination service, to make a decision as to which type of legal mechanism they will use to administer the COVID vaccines under, whether they'll use a PGD involving a pharmacist only, or a national protocol where there is a potential for certain elements, like, for example, the activity of injecting somebody, which may be delegated to another suitably trained vaccinator. So that's an option. And if you've not had a chance to look at the national protocol, then please do so. It's part of the recommended reading in terms of the COVID-19 vaccination program to understand how the protocol can be employed. Now, with regards to the workforce, the expectation in the English service is that any expanded vaccinator workforce that is used at the moment for the 1,000 jabs a week vaccination sites being run by pharmacy contractors, that they manage their own workforce requirements and vaccinator requirements. There is now, in the last few days, another provision been put into place where they can draw on an expanded workforce from within the NHS setting, and some information has been issued by NHS England regarding that. And I'm not sure if there's going to be similar arrangements potentially in Northern Ireland.
Not sure, Jasmine. I suppose the bit that is different for ourselves in terms of using the skills of other healthcare professionals, where our colleagues in England will draw on their registered pharmacy technicians, and so we don't have that option here. So it is more likely that it will be a PGD pharmacist-led service.
Yeah. Okay, no, that's good. Thank you. So just moving on to the premises requirements, and we talked a little bit earlier about the assurance and the governance and the standards. So the premises requirements are quite simple, that as any COVID-19 vaccination service being provided on a registered pharmacy premises or from an associated premises has to meet the GPHC or PSNI premises standards. So the GPHC's expectations are that, and I'm assuming the PSNI expectations will be similar. And the other key thing is, of course, that the COVID secure measures of social distancing and the hygiene and the face coverings would all apply as means of controlling infection prevention measures as well. So all of these are standard requirements under the English service, and I would imagine they will be equally standard to actually all UK countries in terms of what the premises suitability would be to provide a vaccination service, basically. Yeah, thank you. So to assist our members in conducting a risk assessment for vaccination services generally, and this can be applicable to all types of vaccination services and to the COVID service as well. We produced a risk assessment template that might assist you in thinking about all the different things to think about and highlight any gaps and potential risks identified and sort of take measures to mitigate them. So that's available through the NPA at the moment. There's also a workplace risk assessment, because that's also one of the key requirements to ensure that from a staff security perspective and helping manage the workforce, that a workplace risk assessment is conducted to protect our own workforce as well. Consultation room. So when the vaccination service is provided on a pharmacy premises, the expectation is to use a consultation room But if you need to, in the English service, then additional space is permitted to be created through means of using privacy screens and other cubicle-like spaces to create additional capacity for more vaccinators to vaccinate. But this is again built into the site risk assessment, the workplace, and the vaccination services risk assessment to see how the movement of patients and the vaccinators will all work, and how the spaces can be used safely in a COVID secure manner.
And just pick up on the training. I think we questioned through in relation to training. So basically, for anyone who has existing vaccination skills, Public Health Agency and the board have made or mandated for some additional COVID specific training to be completed. So they're using the Public Health England resources, and there's a module on core knowledge for vaccinators, and a module on the Estrozenica vaccine itself. So those are completed. What each vaccinator then needs to do is to check the competency checklist, the assessment tool, and complete that. And then if there are any additional training needs, they can pick up on those either through the public health modules or through other sources. And wrapped around that then, and checked as part of the competency assessment tool, will be that all vaccinators have basic life support and anaphylaxis training. For our colleagues in England, there wasn't specific training allocated by their commissioners. So we did put together a COVID specific module, a 1-hour virtual training module that helped to meet the competency assessment tool. In Northern Ireland, the training that's probably most applicable will be those for new vaccinators. So for people who haven't completed their face-to-face training, either in preparation for a flu or travel clinic, we're offering a virtual 2.5-hour intramuscular skills vaccination training, which will also cover then the life support and anaphylaxis. That gives you the knowledge and the background and the theory, in order then to be able to meet the requirements of the competency assessment tool. Anyone who's completed that training will need supervised practice under an experienced vaccinator to demonstrate their skill, and that vaccinator will then sign off on their competency to meet the requirements of the assessment tool. So we have there's a number of dates coming up. The first one, Sunday the 21st of February, for that virtual training for new vaccinators, and other dates will be added as demand and in the near future. So that's the training requirements. Anyone who completes the vaccination skills piece will then also have to do the modules as required by Public Health Agency and the board in terms of the vaccinator skills. To get supervised training, and see questions just coming through there. So you need to make contact with someone who has administered vaccines in the past. So it could be a pharmacist colleague who's participated in the flu clinic, for example, or a nurse or a doctor or other vaccinator. So tapping into your local network and asking that person to, you share the competency assessment with them, and they assess you across the prerequisite list of skills that are within that. I think that was all the questions in terms of training. Anything else we can pick up as we go on? Mention just the training requirement for the basic life saving and anaphylaxis. So that will be, as you're familiar with, the requirements for under the flu service. Jasmine, could you pick up in the query? There was an addition to the Green Book in terms of oxygen at a vaccination centre. Can you expand on that a little bit?
Sorry, did you say oxygen at the vaccination
centre? There was a requirement that for the management of anaphylaxis, that there should be access to oxygen. There was clarification provided then that wasn't it wasn't a necessity, but it was as part of anaphylaxis management to consider. but the basic requirements are the access to the adrenaline and the life-saving skills.
Yeah, so I think this has cropped up, and it only sort of was raised very initially in December at the start of the vaccination program. You'll recall initially the program, when it started in England, started mainly in the hospital sites and using the Pfizer vaccine. And initially there were reports, a couple of reports of adverse reactions where individuals were hospitalized, etc. But generally speaking, our understanding is that in the pharmacy-led sites, which are up and running at the moment, I'm not aware of there being a requirement for oxygen, but the requirement is to ensure that there is resuscitation facilities available in the sense of managing anyone suffering an anaphylactic reaction, having access to adrenaline, being able to call for help, and having trained people trained in basic life support and anaphylaxis management to be able to support the individual. And also, when we look at the likelihood of an adverse event occurring between the two different vaccines, there is some information in the in the guidance which has been issued for healthcare practitioners that in clinical trials and things, they found that actually adverse events were more likely to happen with the Pfizer vaccine, where over 80% of the participants in trials experienced some form of an adverse event, mainly in the shape of pain at the injection site, usually, and afterwards. But about 60% of the participants in the AstraZeneca trial experienced things like tenderness at the injection site, redness, swelling, etc., things like that. It's not, the expectation is that with the vaccines that are with you, as you know, with the Pfizer vaccine, there is a mandatory 15-minute period of observation following a Pfizer vaccine being administered to somebody. And that means you have to sit the patient down for 15 minutes and they have to stay there while they are observed. And this is a mandatory requirement. That is not in place for the AstraZeneca vaccine, which is the vaccine that most of the pharmacy sites have been issued with. However, the general advice is that regardless of which vaccine has been administered to the patient, they should not drive for 15 minutes, definitely, and leave that sort of time before, if they've driven themselves to the center, to drive before they start driving a car, kind of thing. So, yeah. But if need be, we can look into the oxygen requirement a bit further to see if there's any specific requirements being put into place for under the Northern Irish service potentially. There's certainly something to look at, but not something at the moment that I'm aware of being in place for the pharmacy-led sites in the English service.
Thank you, Jasmine. Just there was a question, just maybe worth picking up just when we're at this point. Use of lateral masks.
So this is part of what so generally speaking, the information available in terms of what sort of basic life support facilities and everything available comes from the Resuscitation Council guidelines, essentially. And what the guidelines currently say is that an anaphylaxis pack would normally contain, adrenaline, the relevant needles, syringes, and the use of lateral masks. But because of the COVID risk, you're quite right, Joanne, to raise the point, the training that the NPA has put into place, the vaccination training, would sort of take that into account about how to provide basic life support in a COVID secure manner to protect both the patient and the person providing the basic life support to the individual. So all that is covered. What we've drawn on here is what is a standard anaphylaxis pack, which contains these items. But you're absolutely right. Under the COVID secure measures, it's been a modified form of thing. And this is covered in our vaccination training, how to go about it.
Okay, thanks, Jasmine. There's a couple of questions just coming through about supervised administration and vaccinators, if they'll have received their second dose. We'll maybe pick those up at the end.
Yeah, happy to do that.
Motor on through just a few of the resources here.
So just this very quickly pointing out that, every year historically, this happens in the flu service, that there is a shortage of EpiPens and auto-injectors of adrenaline. So it's become more and more important that pharmacy vaccinators providing any vaccination service are comfortable drawing up adrenaline from ampules or vials and injecting it. And to support that, we produced an adrenaline administration swab just to help vaccinators. Thank you. Consent, as with most services, informed patient consent should be obtained before the vaccine is administered to somebody. Just because somebody has made an appointment and come to the vaccination center, perhaps should not be taken as given that they're comfortable proceeding with it. So it's just to highlight the point, and it can be verbal consent. But this would be part of the service, built into the service anyway, the record keeping and consent requirements.
Yeah.
Yeah. There's a number of special considerations for administration. Now, there is detailed information about all of this, which is covered in the document, which is the which is called. Oops, sorry, just pulling this up. This is part of the recommended reading that Anne covered through earlier, which is the COVID-19 vaccination program information for healthcare practitioners. We are on version 3.2 at the moment, and it's being continuously updated as more information becomes available. And it covers the contraindications, obviously, about injecting COVID-19 in various situations, people taking medications or having different conditions, the age-appropriate use of the vaccines, etc. And it's all covered in that one document, which is a very, very useful clinical piece of information to be read alongside Chapter 14A, and obviously the PGD and the national protocol. I would say that those are the 4 key documents that should be a must read before any COVID service is started. And again, record keeping, we're just sort of drawing upon the English record keeping and appointments thing at the moment, which there will be worked through for a Northern Irish service. But in England, the clinical records have to be made contemporaneously at the time of vaccinating the patient, and as they go along the process, they're captured onto the Pinnacle system here, and it's all linked into the national vaccine database that's capped, so that all of this can be nationally coordinated. Patients book their appointments to the national booking system. Currently, the booking system can be accessed to the nhs.uk website, where patients in the first 4 cohorts and frontline health and social care staff can actually go online and book both vaccine appointments at the same time. With the other cohorts, we're still waiting to see what happens from cohort 5 onwards, downwards, basically, to see how that works out.
Okay, thanks, Jasmine.
So,
and that, I think, brings us to the end of the operational piece and delivery of the service. Happy to bring in Glenn Waldock, colleague, senior legal advisor within the NPA, just to talk a little bit about some of the professional indemnity and insurance implications. So you're very welcome, Glenn.
Thank you very much, Anne. Thank you. And I hope I should be able to sort of take this fairly quickly, actually. The basic premise, or certainly the circumstance that applies in England at the moment, is that the NHS have confirmed, and this is still, the pharmacy insurers are still in discussion, negotiation, consultation with the NHS about the insurance position going forward. But the NHS have confirmed that they will cover those who vaccinate or who administer COVID vaccinations for the clinical negligence side of the piece, and he claims that may result as a consequence of clinical negligence liability. They've agreed to cover that side of things until the 30th of June 2021. And I believe that in Northern Ireland, certainly nothing is yet in writing, and correct me if I'm wrong on that, but I think there's an indication that's been given that is probably to be the case as well.
Yes.
So yes. What I will say is that certainly at the outset, once you've been given authority, or you've given a contract, or whichever way this is going to work, to either participate or undertake one of these locally required services to deliver a mass vaccination site, or that you're going to partake in an additional service from a pharmacy, let us know, and we'll then advise as best we can on the insurance arrangements across the piece, because it's not obviously the main concern, I think, for any pharmacist, any healthcare professional, is I need to satisfy myself that I'm covered from the professional liability angle, and certainly for clinical negligence claims that may emanate from the vaccine administration. So as I say, the NHS will hopefully cover that in Northern Ireland as they are in England for the time being. But the other areas to consider, because of the additional PI piece, the other bits and pieces that revolve around the pharmacist practice, which may not be COVID related specifically, but may nonetheless crop up in the course of partaking in a COVID vaccination environment. And what we at NPA Insurance have said is that we will cover members and those that they employ if they're going to take part in these services for the other professional indemnity bit that we would normally expect to cover in any event, and also of course any legal expenses, legal defence expenses aspects that may emanate. So things like complaints being made against registrants that may be related to the COVID service. So whilst we're not indemnifying the liability, we will continue to cover the legal defence side of things. So as I say, complaints made to regulators or potential prosecutions or anything of that sort. The other area to bear in mind, of course, is the general insurance side of things, and under that area comes the employer's liability insurance and certainly public liability insurance where services are being provided away from the pharmacy premises. So if you're, for example, participating in one of these mass vaccination sites that isn't registered, which probably won't be registered premises, not as pharmacies anyway, then let us know, because in England, pharmacists have been hiring out halls and perhaps leisure centres. So there are sort of hire agreements perhaps in place where the obligation is imposed by those who are hiring out the premises on pharmacy to ensure that there is public liability and other employers' liability insurance in place. And so not all NPA members have their general insurance through NPA Insurance. The professional indemnity piece, of course, is there, and the legal expenses side of it. But do let us know, because the advice that we're giving to members in England is, well, you should contact your own general insurers if you don't insure with us for that purpose. If you do insure with us for that purpose, then we will do obviously all we can to make sure that other potential insurance liabilities are covered off. So as I say, I think the overriding message is, as soon as you know what you're going to be doing, get in touch, let us know. We may ask for copies of the contract documentation or the other authorities that you may well receive, and then we should be able to give you a very good steer. I mean, what we're doing, we're dropping members who contact us an email saying this is the position, this is what we're covering you for, this is what the NHS will cover you for. And from the general insurance piece, you either go to your own insurer to find out whether they would extend cover, or they perhaps need to be told that you've got certain of your employees participating in vaccination services, because again, there are potential liabilities, as we know, that can befall employees whilst they're working for you. And so it's as well that your employer liability insurers know what's happening there. And I think that's it in a bit of a nutshell. So that's it for me. Thank you, Anne.
Thanks, Glenn. There was just a question came through from Raymond there in relation to administering vaccines to a patient in their own home. What are the insurance considerations around that, or will the insurance cover a vaccinator traveling out to someone's home?
Okay, well, again, if it's a COVID vaccination, then the clinical negligence side of if there are any issues that arose from that, one would hope that the NHS, as part of confirming, and as I say, we know that the word is out there, but there's nothing as yet in writing, that would encompass the clinical negligence side of COVID administration. In terms of seasonal flu, which of course we've been covering for many a year now, if pharmacists go out to nursing homes and to administer seasonal flu vaccinations, then you're covered by us as you would be normally. It's just the COVID vaccination piece that is the if you like, the ring fence bit that we have said, and as I say, ongoing negotiations, discussions with the NHS, with all the pharmacy insurers to try and hammer this out, hopefully before the end of June. Yeah, I hope that's answered that, Raymond. Well, I've answered it as best I can.
Thank you, Glenn.
Thank you.
Just by way of summary, and we're just coming up to the hour mark, there were a couple of questions around supervised administration and assessing competency. So check the competency checklist that all vaccinators have to sign off on. And for new vaccinators, they have to ensure that they meet the criteria within that. So there's not a specified number of vaccines that have to be witnessed, but it is to provide assurance that the vaccines are being administered competently. In terms of getting some professional support in making providing that supervision, certainly if anyone has any queries, and I know Ronnie, you picked up on it, happy to signpost you to colleagues maybe within your area that you can approach. As I say, it doesn't have to be a pharmacist vaccinator. It can be a nurse or doctor who also have those skills and who can provide the assessment. So happy to take that offline if you want to discuss through a wee bit further in terms of getting that competency completed. Had another question from Mark Timoney, Mark, about will vaccinators have had their second dose? I don't know. And Jasmine, the situation in England at the moment, I guess lots of those that are delivering the vaccines may not have been vaccinated themselves or still only have their first dose. So I'm not sure that the second doses will be administered perhaps before the in-pharmacy service starts off.
So, and the situation in England is that the NHS and the government had set a target for the first 4 cohorts of the JCVI priority groups to be vaccinated by the 15th of February, which is coming up on Monday. So currently there has been a massive push for it, and there has been a huge uptake of the first doses, obviously in those 4 cohorts. And just a letter of assurance requirement has just gone out the other day from NHS England, yesterday or the day before, to all CCGs and ICSs and STPs, asking them to provide assurance by this Friday that all frontline health and social care staff have been offered the COVID vaccine, to guarantee that, basically.
Okay.
Obviously, being offered and the uptake are 2 different things, as we know.
Mm-hmm.
But it is hoped that a huge budget. So there's a massive drive at the moment, and that is one of the reasons why we also think that the national booking system has just changed overnight, as I mentioned earlier, where people can actually proactively now go onto a nationally available booking system just openly as a frontline health and social care worker and book themselves in, and the system allows you to book both of your jabs in and gives you the appointments for both of them. So yeah, the vast majority of frontline healthcare staff will have had their first doses at least by now, or should be coming up to it very, very shortly in the next week or so, hopefully.
Yeah. Does that answer, Mark, for you? Is that?
Yeah,
Okay.
but that doesn't mean that every vaccinator will have had their first dose before they necessarily started vaccinating other people. That's true. Yeah.
And I think the only other question I picked up on, although I think you did address it, Jasmine, and the documentation that we've shared just in the chat, but we'll also email out
Of course.
with a copy of the recording, is in relation to the rate of adverse effects from the vaccine. So
yeah, so as I mentioned that, so key document 1, which I put in the chat box link, it has a lot of clinical information, and I believe it's section 9 in that, which covers the potential for adverse reactions following the vaccinations. Now, that information at the moment is based on the trial data that was submitted for both Pfizer and AstraZeneca vaccines. And we do know that there is some data will be starting to come out of the people who've been vaccinated so far, and they're being followed up to see how many of them. So hopefully there'll be more information available from that, from the bigger, the mass vaccination program available hopefully soon in that respect. Yeah.
thank you.
But overall, it is a new vaccine. And I do know from some of our members who are providing these, the 1,000-a-week sites, that even though they're all being given the AstraZeneca vaccine and they don't have that mandatory, 15-minute post-observation periods, some of them are choosing to implement it as a means of assuring themselves that the patient is okay. So even with the AstraZeneca vaccine, they're saying, we prefer it if you just wait here for 15 minutes so we can make sure you're okay before you leave, kind of thing. So it's what people feel that they should put into place for the assurance purposes. Yeah.
Okay. I think that was all the questions. Certainly, if anyone has anything that they think of, and prior to services going live, drop me a line or pick up with Jasmine or Glenn and myself, and encourage all to follow Glenn's advice in terms of sending through any of the sites or the information in that, so that we can get to work on any of the insurance implications. I just want to thank everyone very much for taking your lunch hour to come and join us today, and I hope you find it useful and are on the road to commencing the service or getting prepared for the service. We will share a recording and the resources that we've referenced through the presentation. So if there's any other queries, certainly get in touch. But other than that, thank you very much and have a good afternoon. Thank you.
Thank you all. Bye.